And this is a good example of curly lines. And how these lines, you know, are not in your face densities. I mean, you have to look for them. And we talked about the different lines that Curly described. The C lines are probably a non-entity, and we don't really worry about the C lines. A lines and B lines. But the B's are much easier to see, aren't they? Mm-hmm. This patient has really nice B lines behind the sternum here. It's all these little short lines that are perpendicular to the chest wall.
Okay.
As the chest wall curves, they change because they maintain this perpendicular relationship, and they're only about this long. They come out here like that. These are all curly B lines. Behind the sternum is one of the easy places to see them. Above the costophrenic angles, there's one right there. See it right there? Mm-hmm. Now, it doesn't mean they got to have 3-4 dozen of them. They may only have a few of them. There's more actually behind the sternum on this example than there are above the costophrenic angles. There's one, faint one right there, probably one up here. And this is an A line right there. But see, the A lines compete with the spider web of the reticular interstitial pattern. That's why the A lines are so difficult to see, because you already have a linear pattern where you're trying to look for another linear pattern. But pulmonary edema, which is what we typically, you know, produce curly lines, that typically is in the medullary part of the lung. So there's not much out there in cortical lung. That's why it makes the B lines easy to see.
Are the B lines easier to see behind the retrosternal versus,
No.
or just in this case?
No, in this case, this one's got more than it does here and here. But the best places are here, above the costophrenic angles, and behind the sternum for the B lines. That's the best place to see them. Could you have them back here? Sure, but look what you got to try and look through. You got to try and look through ribs and all this to see them. It's just much easier to see them behind the sternum. So what do curly lines do for us? What did we say they do? One,
if you have A, you have B.
Confirm interstitial disease, because that's the only thing we see them with is interstitial disease. Okay? So they confirm interstitial. B, what do they do to anatomically?
The secondary lobules.
They're due, not calcification, just thickening.
Okay.
And it's usually just edema fluid thickening the interstitial membrane between secondary lobules. That's why they're also called septal lines, because there's a septum separating secondary lobules. So septal lines is kind of a generic name for curly lines. And 3, pulmonary edema. That's classically what they indicate. Cardiovascular or non-cardiovascular related. Now this patient's is cardiovascular related because we've got the prominent upper lobe veins, which is the Viking hat sign, going up like this. That's those prominent, very distended veins. We've got big hilar areas. So something is backing blood up into the lungs. That something could be heart, could be something in the left side, left ventricle failing, mitral stenosis, a tumor in the left atrium, something in the mediastinum that's compressing the pulmonary veins. All of those things back the blood up. The blood can't get out of the lungs fast enough. And so it backs up, and as the pressure goes up back into the capillaries, it starts forcing more plasma fluid out faster than the lymphatics can absorb it. So we get an imbalance between, you know, outflow and absorption. We get more outflow. The lymph can't absorb enough, and then we start getting all that thickening in there. So that's what happened in this individual.
Would you call this one reticulonodular?
Yeah. Mm-hmm. Yeah. And the difference is, if you remember the butterfly shadow, this is just before it's a butterfly. That's all it is. This is basically the same area as the butterfly shadow, but it's interstitial instead of airspace. That's the difference. Both are pulmonary edema patterns. Interstitials first, airspace is second. Okay? That's it.